سلام عرض میکنم خدمت شما بینندگان گرامی. من سینا دشتی هستم از سوئد و امروز در چهارمین کنفرانس آنلاین با همکاران روی خط با شما هستیم تا در مورد سوالاتی که حول این بیماری کووید 19 یا بیماری کرونا هست در حد توانمون جواب بدیم و اون چیزی که در نظرمون میرسه به نظرمون مهم هست با استفاده از سوالهای شما در اختیارتون قرار بدیم. اولین
send my greetings to all the nurses, doctors, physicians, health workers who are supporting our compatriots in Iranian hospitals on the front lines today, and for them to know that we are with you, we are thinking of you, and we are supporting you regardless of the difficult situation that exists today in your work. We believe you are doing an excellent job that will be remembered in Iranian history and will add to your stature. Now, we are in a situation where the regime, the Mullah's regime in Iran, has done absolutely nothing for the Iranian people, but has endangered the Iranian public and harmed the Iranian society because of its actions. The first issue I wanted to address is that the regime knew that there was the COVID-19 infection in Iran in late January, according to and early February, according to documents which have been received by the National Council of Resistance of Iran. I would like to share some of those documents with you, which form the factual basis of this assessment that the regime knew early on in the beginning of February that a person in Iran was infected in the airport, the international airport in Tehran, on the and he was hospitalized, and he was suspected of having corona virus infection. And this document shows that the regime knew in advance of this issue. And the second document is about a lady who had come from in contact with Chinese travelers. And this is a document on the 31st of January. And this document has been registered by a formal agency in Iran that shows that they knew what was happening and what was going on and what it was hiding and what it was covering up. And this concealment, these lies by the Iranian regime have led to actions which have actually in violation of international agreements and covenants which the regime has signed, that any country that knows of something that might result in a health epidemic must inform and bring notice to other in 24 hours to the World Health Organization. It must inform the World Health Organization, WHO. But this regime did not do that. It concealed these facts, concealed these documents, and did not relay this information to the WHO. which is part of its obligations and responsibilities under treaties and conventions it has signed with the World Health Organization. So these policies which the regime is pursuing are not only against the Iranian people, but also the international community, and endangering them. And the regime has now declared that by the by the 9th of April, all activities, economic activities in the country must start, which is really very dangerous action, and will lead to the death of probably 1 million Iranians if this happens. We do not condone these irresponsible and criminal actions by the Iranian regime, which will lead to the widespread death based on the COVID-19 infections. And many of our compatriots have reported to us, and many reports coming in from Iranian hospitals as well, that this infection is spreading. In developed countries such as Sweden, the United States, European countries, governments are taking on the burden of citizens so that they can stay in self-isolation and to avoid social interactions, to create the situation and for social distancing. But this regime is just plundering the billions and billions of dollars of the Iranian people's wealth and sitting on that wealth and not using it, and instead taking actions which will lead to the spread of this infectious disease. Organizations such as the foundations in Iran, which are affiliated to the Khamenei's regime, are sitting on a vast amount of wealth which is not being used to combat this disease, and it is asking people to go back to work, which is very, very dangerous. This is the situation that we are in at this moment, and during these times we have tried to create a international organization of Iranian physicians and health workers throughout the world, so that we can take effective action to help the Iranian people in these times when the regime is irresponsibly and criminally damaging their health and their well-being. And this organization has been formed in various continents. Some of its activities are these conferences which you are viewing now, which we bring information to the Iranian people and Iranians throughout the world, and especially in Iran. And we have other activities in relation to the WHO and to health organizations in Italy, in Sweden, in the United States. So to bring assistance to the Iranian physicians and health workers in various hospitals in Iran, so that they will be able to effectively do their job in combating this infectious disease. This conference, if you will allow, we will begin it now at this moment by introducing my colleagues who are participating today. From Sweden, we have the neurologist Reg Abedini. From Australia, we have Dr. Omid Sadegpour, who's a laboratory manager at microbiology lab and doctor of public health. And we have from the United Kingdom Dr. Ladan Alijani, a pharmacist in the UK. And in Italy, We have Nariman Ardalani, who is an epidemiologist and dentist.
دکتر نریمان اردلانی رو داریم که در اپیدمیولوژی تحقیقات بسیار جالب انجام دادن که خودشون بیشتر توضیح خواهند داد. و در آخر در نروژ دکتر سعید توتونچیان.
And we also have Dr. Said Tutunshian, a GP general physician, who is the physician to the Norwegian women's football team. We will be starting our conference, but before we begin, I'd like to ask for a clip about the World Health Organization with Farsi subtitles to be broadcast. Please take a view.
Only help you in the long term. First, eat a healthy and nutritious diet, which helps your immune system to function properly. Second, limit your alcohol consumption and avoid sugary drinks. Third, don't smoke. Smoking can increase your risk of developing severe disease if you become infected with COVID-19. Fourth, exercise. WHO recommends 30 minutes of physical activity a day for adults and 1 hour a day for children. If your local or national guidelines allow it, go outside for a walk, a run or a ride, and keep a safe distance from others. If you can't leave the house, find an exercise video online, do some yoga, or walk up and down the stairs. If you're working at home, make sure you don't sit in the same position for long periods. Get up and take a 3 minutes break every 30 minutes. Fifth, look after your mental health. It's normal to feel stressed, confused, and scared during a crisis. Talking to people you know and trust can help. Supporting other people in your community can help you as much as it does them. Check on neighbors, family, and friends. Compassion is a medicine. Listen to music, read a book, or play a game. And try not to read or watch too much news if it makes you anxious. Get your information from reliable sources once or twice a day. COVID-19 is taking so much from us, but it's also giving us something special, the opportunity to come together as one humanity, to work together, to learn together, to grow together. I thank you.
مفصلی در سایت همبستگی ملی نشوندی تحت عنوان بروز ویروس کووید 19 برای دستگاه بهداشتی کشور با این مختلف به آزمایش سختی تبدیل شده است و اون رو به عنوان یک جنایت اعلام دیگر آخوندها علیه بشریت توصیف
and
کردید.
the criminal
ممکنه
actions of
که
the Ba'ath
لطف
regime in
کنید
this regard
بیشتر
in
این
Iran.
بحث رو باز کنید
Can
برای
you
شنوندگان
please
ما؟
explain
بله، با
provide
سلام
explanations
به
to our
تمام
viewers?
شنوندگان این برنامه و
Hello to all our viewers and all my colleagues here.
تحقیقی کردم خیلی ساده.
We have engaged in a study and taken the statistics of the Iranian regime from the health ministry of the Iranian regime according to their AVA yearbook. And I have contacted other health organizations throughout Europe and the United States, and especially a comparison between the European figures and statistics and those from the Iranian Health Ministry. And we will talk about these statistics and figures. There are some international standards which rank different health systems. If we take a look at the number of physicians according to per capita and hospital beds per capita and other facilities, you will see in Germany, which is about 80 million in population, there are 660,000 beds. In Iran is 110,000. In other beds are 28,000 in Germany, 5,000 in Iran. And in Iran they say 80% of those beds are not up to international standards. 30% of these beds are at the disposal of military forces and security forces in Iran. In Iran, we have about 97,000 physicians. You know that, first of all, getting correct statistics, transparent statistics in Iran is difficult. We have also 120,000 nurses. So for every 100,000 person, we have 1.5 nurses. And for 825,000 people, we have 1 physician. So this creates a big problem. And when a pandemic such as COVID-19 arrives, we will have a lot of sick people coming into the health system which need treatment. And about 20% of people who are infected by COVID-19 need respiratory devices to assist in their breathing. In Iran, there are 5,000 beds, and we are in a situation where the regime does not have the sufficient capacity or infrastructure to meet this situation. In Germany, in Italy, in Spain, in other countries which are more developed and have a lot more physicians and nurses, we see that they are being stressed in facing the COVID-19 crisis. So we can understand very well what is happening in Iran then. We see that the European countries are and governments are countries whose economies are very much in debt maybe, and they have economic crises, especially in recent years. But in addition to having facilities and health systems to meet these challenges, for example, the Lombardy province in Italy, with about 10 million in population, the number of emergency beds was 1,200. In Iran, the regime uses the COVID-19 crisis to further its own political interests and its own intentions in breaking, for example, the sanctions, etc., and not for combating the virus among the Iranian population. I wanted to refer to two figures here. Kianush Jahanpur from Iran has said that about 39%, the number of people is 56,000 people that are infected by COVID-19, and 3,452 people have died in Iran. And then we have Eric Bernon, who said that you must multiply Iran's figures by 5. So if we multiply the figure by 5, it is approximately the figure that the People's Mujahideen Organization of Iran has declared to be the correct, maybe, estimate of the death toll in Iran. If we accept the statement by Eric Vernon, we would say that the number is about 6.7, the death rate is about 6.7%. But in Lombardy in Italy, for example, which had so much capabilities and capacity, because of a mistake that the health system over there made, the death rate was 13% in Lombardy province. Now, if we make 13% the rate in Iran, we would see that the number of those who have been killed by the COVID virus in Iran, it would be above 22,000, 23,000. So these figures will later be revealed. The consequences of these death tolls will be that the regime is killing the Iranian people, and also the economic disaster that has come because of this situation. So all governments are taking actions to do social distancing to avoid the spread of the infection and COVID-19. And but the Iranian regime will not be able to cope with the economic consequences of this crisis and this situation. And because of the funds that it is funneling to regional interventions, the support of terrorism, and other issues, and then the Iranian people will definitely bring to account Ali Khamenei and the Iranian regime for what it has done to the Iranian people and Iranian society. If there's more time later, I may be able to explain this a little bit further. Thank you very much. Thank you for your explanations. I would like to stress myself that based on the article that you wrote, there are one physician to each 232 persons in Germany, and one physician to each 825 people in Iran. One of the nurses in Iran that has contacted us from inside Iran has said that the coronavirus patients die because of and their death is put down to other causes, and that's why the death toll is intentionally engineered and kept at a low level by the Iranian regime and authorities. So everybody is aware of that and is stressing this point. Our colleagues in Iran have to use one set of clothing, and many of them have been infected by coronavirus also. Facilities and supplies, medical supplies in hospitals to combat this by the health workers is very much very low. They have been left unpaid. Their salaries are unpaid, and but still this regime finds money to use for the sponsorship of terrorism and its interventions inside in the region. I have here news that a person is writing that there are so many deaths within our hospital, that it is hard to keep pace. If many of the times the authorities do not report that this is a coronavirus death, but usually write that it's heart effects or lung disease, and receive money for producing such lies. We will now go to the general effects of the epidemic in Iran. Until when are we going to be seeing the rise in this epidemic? I'd like to say hello to my friends here, the colleagues in Iran, doctors and nurses who are on the front lines of the combat against this infectious disease. Despite the existence of a murderous regime in Iran, they are doing their best. They're risking their lives. Hopefully one day we will be serving our people together. Regarding your question, I must say that unfortunately we are faced with a lying regime, such as the Iranian regime, and we cannot give you exact figures, and we cannot trust the figures which the Iranian regime gives, and we cannot precisely point to where we are in this fight against coronavirus in Iran. But what I can point to is that the regime has said that the Iranian people should return to their work on the 8th of April. I think this is impossible. This will show that Iran is in a very bad situation, and the only thing that this regime cares about its own ability to raise funds and revenue for its own aims. But the country is paralyzed. The Iranian regime is not thinking about the welfare of the Iranian people, and the 40 years of suffering which it has imposed on Iranian society. And the only thing I can ask from our people is to continue social distancing, to continue their self-isolation and quarantining, in order to avoid the dire effects of the spread of this virus, and to not go outside despite what this regime is saying now. And there's not going to be a second wave or third wave. This first wave will create a very, very huge death toll if people are forced to return to the streets and to their employment and work under such circumstances and in this situation. Therefore, you should not listen to the lies of the Iranian regime and the concealments that it is doing and cover-ups. And unfortunately, we cannot say where we stand at this moment. The only safe route is to continue the quarantine, to have good hygiene, keep ourselves in good health, to continue to practice social distancing and self-isolation, to wear masks, and hopefully we can flatten the curve of the spread of this virus. And with such an incompetent regime, this is the only path forward. I want to ask Dr. Ali Jani to explain to us the situation of medical supplies and medicines. Can a specific medicine be recommended to patients who have mild effects of the virus? Some studies have been published about some trials of some medicines which might be effective against coronavirus. Is it possible? Can COVID-19 be mitigated, the effects in the first hours? I'd like to say hello and to all my compatriots, to you and to my colleagues in Iran and the health workers who are risking their lives under this regime, which is imposing a very dire situation on them all. WHO recommendations have been repeated here, and this should be followed. Mild symptoms of the illness has been published in Herbiology magazine and journal, and several days ago it was published, and I will explain a little bit about that. Mild symptoms are headaches, shortness of breathing, and kidney problems, and coughing, and as the WHO has also said, 80% of cases do not need hospitals or a general physician to attend to them, and they should follow recommendations to stay at home and to only use medicines that might assist in mitigating the symptoms of the condition. Now, some of the medicines that can be used are some pain relievers for headache, and if there's no allergies, there are some pills for sore throats, and good food should be used to keep yourself healthy, and also engage in exercise and keep yourself in good spirits so that you can combat the virus as you need. In 20% of the cases, patients will need, especially those who are above 70 years of age and who have heart problems or high blood pressure or cancer or respiratory problems, to go to a hospital because of a heightened problem in their underlying conditions. It is better not to use any medicines other than those that have been recommended by health authorities. Some people ask, what can I go buy from the pharmacy? The 20% that we refer to, 20% of patients, in reference to the medicines that can be used, these medicines are really needed for these 20% of cases. And yes, some medicines are being prescribed out of not having any other solution. Some of the medicines are those that have used against H1N1 virus in the past, swine flu, or some medicines used to combat HIV, or some anti-Ebola medicines, which is in phase 4 testing. And if people are in critical condition, reach a very critical situation, these medicines are recommended, are used. And there's another medicine called Avigin, which is used against viral diseases. And some limited studies and clinical trials have been done. And some of these medicines have shown more effectiveness. I want to also point out to hydroxychloroquine, which is a medicine which was used in World War II as an anti-malaria drug, and it is once again it is being traded in the market in Iran at very, very high prices for about 20 million local currency tuman, and it's usually the IRGC that is putting this into the black market and trying to turn a dime and to get revenue. This drug is usually used to for malaria, and there hasn't been too many clinical trials or studies on this, and it is not generally recommended, but it is used in some cases. Now, going back to your question about this article in this journal, it was very interesting. 89 people were tested. About on the ACE2, for this drug cocktail which was given to them, they did not have any symptoms after some time, and it was interesting. If this clinical trial reaches the third phase of testing for up to 3,000 people, and if it passes that testing phase, it will then be available on the market. And in several places in the world, these studies and trials are ongoing so that they can achieve some effective medicines against this disease. I'd like to explain for 1 minute about this drug. This virus connects to receptors on the cells of the lungs and also in the digestive tract and in and people who become sick have dizziness, and they have kidney problems and respiratory problems. This medicine that people consume will create very false receptors, so that the virus, instead of connecting to actual human cells, will connect to these receptors and then will be destroyed. So this system of combating the virus is interesting. It is. We hope that it will be something that can pass in clinical tests. At the end, I'd like to say there is a lot of despair, I think, in Iran. I'd like to add that despite all the shortages that exist, if people can follow the recommendations which have been given and keep in and wash their hands regularly before they touch their face, and if they follow the recommendations given, then this is not the most dangerous virus that human beings have faced until now. There has been more dangerous ones in general. So we must try to follow recommendations given by the WHO to stop the fast spread of this virus. And so doctors and researchers will be able to develop a cure, and the health systems will be able to handle the patients. Thank you very much. Part of the question that I asked you, and you explained, Dr. Aljani, the issue about the anti-malaria drug, and the dispute between the health ministry and a hospital in Iran regarding this issue. If you can, to some extent, let us know about this dispute that is going on about using these drugs in Iran. Hello to you all and to our viewers and my friends and colleagues in Iran. And I'd like to congratulate you all for your work for the Iranian people under severe shortages and your efforts in the front lines to save the lives of our compatriots despite the work of this regime. Now, I'd like to say a small introduction about Dr. Al-Jari, of course, gave a very complete expose about these medicines. The coronavirus, COVID-19, belongs to the larger SARS family. So we can understand the relationship between the various medicines which we will be discussing. COVID-19, as you know, and as has been explained to great length, it shows symptoms similar to the flu or the cold. They're in the same family, with this difference that it has a very rapid spread which reaches the lungs and the respiratory system, and then it infects the respiratory system. It continues to multiply rapidly within the body and takes the patient to critical situation and maybe death. All the medicines that are being tested to defeat COVID-19 is really in trial, and there is no proven medicine that can cure this disease at this point. But these medicines do three important things. One, they decrease the symptoms and mitigate that. Second, they block the enzyme which this virus uses to multiply itself. So it basically slows down the disease and quickens the recovery period. But there's a lot of hope that researchers will be able to develop, pharmacists will be able to develop medicines that are effective, and a vaccine can be developed that can combat the COVID-19 virus. And there's a lot of money being given by governments for this development. Another thing to be done is oxygen treatment. When a patient reaches a critical situation with oxygen therapy and connecting ventilators and respiratory devices, it replaces the respiratory system of the patient. So we can really differentiate these medicines to three groups. The first group is to combat a group of viruses such as ARCI-2, and the other group is the Remdesivir, which was used to combat the Ebola outbreak in Africa. The third group, which is being talked about a lot these days, is the Avigan medicine that has been used in Japan, and Italy will test it on about 20 patients that are in critical situation at the moment. All of these are really being tested right now. A second group of medicines are the medicines have antiviral characteristics which have some effects in mitigating the effects of this virus. Chloroquine is a medicine which is used against to combat malaria in the past. This anti-malaria medicine has an antiviral effect also, which has been used in China to combat SARS or in the past. Now, so these are the various medicines. So Avigan, which Japan used in 2014 to combat influenza outbreak at that time in 2014, have had positive results. So those three antiviral medicines have been approved by the World Health Organization, but these other medicines will need to gain approval by through the WHO. To prescribe these medicines to patients to prevent the body's weakening against the virus, so that the virus will have less effect, is medicines that have vitamin C and vitamin D. And this does not have any scientific basis at the moment, but a lot of people use vitamin supplements. Now, there's a lot of use being made of chloroquine and hydroxychloroquine, but these are all medicines that need to be tested. The Iranian people should know they are not alone, and we are with them. And all the health systems throughout the world are active in trying to find a solution for this problem. Thank you very much. I would like to say that this conference is being broadcast live on Instagram by through the Pek Shadi account. There are some questions which we have received replies about. Whether smoking or alcohol is damaging, or now we want to ask discuss another part of the consequences of this disease, and infectious disease is the psychological side effects of this disease on people who are sick and who are maybe in self-isolation, and the challenges that they face. And basically, I would like to ask Dr. Abedini to give us a little bit insight into what people can do in this regard. I'd like my greetings to all my compatriots and to you for creating this forum so that we can talk to our people regarding these issues. Our colleagues in Iran are unfortunately under severe limitations, but their efforts are very much appreciated. Now, regarding the question that you have mentioned, the psychological side effects and aspects of this of patients who have COVID-19, we have to understand that when there's a crisis that there is no end to, this creates anxiety, especially in Iran under the mullahs, in which people are forced to face anxiety, even to make a living through several jobs. But now, with their loved ones under the threat of being infected by virus, COVID-19 and the coronavirus, and people who have families, who have children, who have to take care of, when they go into quarantine or in self-isolation, and when they receive false news through various channels, they are affected. They understand. They become anxious. They feel anxiety. They are impatient. They become stressed. And there's always crisis in life, but this disaster or crisis is very different at this time. In most normal situations, there are vulnerable people who are affected more. But in this crisis, even people who are even less vulnerable are being affected severely by the consequences of this health crisis in society. So when we look at the recommendations of WHO regarding keeping up your spirits, and this can have a positive effect. So social distancing, safe isolation, quarantining by people who are infected by the virus are faced with insomnia, and are faced with stress, they're faced with anxiety. And one of the studies that was conducted in February by Finance Psychological Society, 13,000 people, about 42% showed symptoms of high anxiety regarding COVID-19. And then post-trauma syndrome has been experienced 25%, which showing PTSD symptoms. So other consequences that we see is the stress on families, on family relations. In Sweden, quarantines have not been implemented yet, but we see that couples are separating due to economic situation. So their divorces are on the rise in some countries, and we have to say that there are some, of course, grounds for these in the past, but this crisis is really creating and accentuating the situation. And just health precautions are not enough. We need to pay attention to the psychological aspects and keeping up a good mental health. However, in Iran, in a patriarchal society which is under the mullah's rule, where women and children are more vulnerable than in any other country, this is very important to pay attention to their health, to their mental health. About 500 to 600 million students throughout the world are at home at the moment. Within Iran, the virus of the Iranian regime added to the COVID-19 virus is having a accentuating effect on the society, and especially students and children, school children who are missing school at this moment. And the effects on families. And so the children are in a very bad situation, and there's a lot of research going on regarding this, and a lot of publications are putting out articles about this issue in international journals. And I've been reading some of these, and I see that in England, in the United Kingdom, in every 8 minutes, a child loses their family and their home, and 126,000 children are living in temporary shelters. And so this disastrous situation is accentuated in Iran. I think of the thousands upon thousands of children who are roaming Iran streets, living on the streets, homeless, and the situation that they are facing at this moment. To avoid the anxieties and stress, we have to understand that epidemics and pandemics have existed before in history. For example, the 1918 outbreak of the Spanish flu, as we know, which took millions of victims. And in Iran at that time also, about 8 to 10 million Iranians lost their lives. In the past, the knowledge that we have today was not available. Medical knowledge was low. And there was a lot of superstitions, a lot of other things at that time. But to decrease the stress and anxiety during these times, it's important to pay attention to some practices that we must engage in. As we said, the World Health Organization mentioned some of those points in his speech. In situation of crisis, we lose our daily routines, and when we are isolated, and when we have decreased our social interactions, our daily routines must adapt and must be more precise and must be scheduled, and we should engage in pay attention to that so that we can prevent the slip into anxiety and depression and psychological effects of the disease. We must pay attention to having good sleep, to exercise, to have good food, and then especially during times where we have less social interactions, it becomes even more important. And so this is one of the most important issues that everyone should pay attention to as something preventive in the mental health area. Now, in regard to children, naturally, in these situations, children come under more pressure, and for various reasons, they are more susceptible, and parents need to be more honest with their children and to answer their questions, and parents should basically remediate their own anxieties before they begin to talk to their children, because young children, even 2 years of age, can understand that their parents are worried and they're anxious, and this basically has a negative effect on them, and we need to pay attention to this point as well. Regarding another question about the challenges that we are facing in this regard, we have to understand that when we are in a critical situation or in a crisis, usually they tell us to have social interactions, but now the World Health Organization, everybody is saying to lessen social interactions, to engage in social distancing. So this creates a bigger challenge and a bigger problem, especially when we have become accustomed to save its energy to move towards behaviors and habits which we have in the past. So it creates a very bad atmosphere, bad situation for a person, that even if you are addictive to something, to a behavior, that behavior can be remediated and changed and prevented. So another point is that is the information which people receive. Now, where is this information coming from? What are the sources? Now, we know in our own country, in Iran, much of the information going to the public is false, is fraudulent. It comes from unsuitable sources. So we have to understand where this information come from, and not be gullible to what the regime is saying, so that this will not add to our stress or anxieties. Now, I would like to shorten my discussion so that others can also contribute, and if there's any other questions, I'll be happy to be at your service. Thank you very much for your points. I would like to request to explain a little bit about exercising. I think being a physician for a football team is suitable for answering people's questions about what is the role of exercise in Iran, for example, for combating this disease. Hello to you and to all my compatriots and my colleagues on the front lines in Iran, who are really putting their own lives on the line in this regard. I have to say that videos that we are seeing coming from Iran every day, we can see that in different cities, in the streets, the situation is very disastrous. People are falling down in the streets, and nobody is there to help them because of the situation that the Iranian regime has created, the shortages that exist. It is normal that most governments help their people, but this regime does not do that, and people should really follow quarantine and self-isolation. But we see videos in Iran that unfortunately the virus is spreading in Iranian society, in streets. Regarding the role of exercise in this regard, when we are in quarantine, we're in self-isolation, without having any athletic device, we can do normal exercises which will help us to keep our health and to combat this disease. It also increases our the body's well-being, and increases our keeps us in high spirits. And throughout the world, all exercises that are social in nature, such as football or others, have been stopped, and because people are told to engage in social distancing and self-isolation, so this carries, because those sports carry the risk of further spreading the virus, and so people are recommended to stay at home. So, but still at home, exercises can be done. So, and because of the social distancing and self-isolation, people need to exercise more at home. And another recommendation that was made was that some anti-infectious disease medicines, for example, in southern France, had seen that anti-infectious and anti-fever medicines were used when these, so the spread of the coronavirus, the body becomes more susceptible to the virus when these anti-infectious medicines are used. So the Norwegian Olympic Committee has told all the athletes they must not use anti-infectious medicines until such time that it is recommended or proven to be used. And people should use less of these medicines. And as my colleague said also, there is no medicine that will serve as a cure against this virus at this moment. And my colleagues have made very precise remarks about this issue. So the most important thing that I can say to people is abide by the rules of self-isolation as much as you can. This is the most effective weapon that we have in the combat against this virus at this moment, to avoid the spread of the virus. Thank you very much. We have received some questions from Iran that I will answer very quickly. In a country where quarantine is abided by, how does this virus spread, and how can people make a living when they are still at home and not going to employment? In a lot of countries, governments have tried to help, so to create conditions for making loans and to make cash assistance to people, companies helping their employees. But in this regime does not provide any assistance to the Iranian people. So my request to all my compatriots is that if you see someone who needs assistance in your neighborhood, in your community, there must be some people who have better situation and will be able to act as a philanthropist and assist others in their community, in their neighborhood, and from a humane standpoint to do what you can in the absence of any assistance from this regime. So the people themselves should be able to do what they need to do and make their best effort so that people don't have to leave their homes, so that the virus does not spread, and this will save lives. This will flatten the curve in fighting this virus, and so that we will be able to put behind us this hard times and situation, to put our hands hand in hand and to combat this virus as best as we can. Look at your neighborhood, look at your community, look around you, see what you have, the resources available, and to help those who are in need so that they would not need to go out and to toil for making a living at this very dangerous point. One person said coronavirus had not arrived in our village yet. What happens if it comes? What should we do so it does not spread? The most important thing is to wash hands, to have good hygiene, to engage in social distancing. These are the most important points, especially frequent hand washing and personal hygiene. And so this will help in avoiding the spread of the virus. And in some communities, some neighborhoods, young people in those neighborhoods have banded together, assisting people who are in need. For example, in some stores in Fars province, people stand outside the shop, and some others assist by getting their foodstuffs and bringing it out to them. So people should really, from a sense of community, help each other and to put this crisis behind us. Someone has asked, what should we do to avoid catching the virus? If you allow us, we'd like to thank you all for your welcome to this program. We have gone 10 minutes over time. We will be at your service in the future as well with more conferences, and we will continue it perhaps in the future, and we will promise you to do that. I hope that this conference has been helpful. It has been broadcast live on Instagram, and if you would allow us, I will ask a question from Dr. Tutunci. In Norway, there is a test, a medicine that is being tested on individuals, and the WHO has recommended a trial of a medicine in Norway. Is this correct? Can you please answer that, Dr. Tutunci? Yes, this medicine is one of those that have been mentioned here, and all of the hospitals in Norway are testing this at the moment and doing research in accordance with the WHO. All European governments have also engaged in this trial, and they are researching on this drug on a daily basis. Other drugs, in addition to this one, are there is no other medicine other than this one that is being used at the moment or tested. Thank you very much for your response. On behalf of all my colleagues who have participated in this conference, and the Pekishadi channel, which has provided us the ability to live broadcast this program, I would like to thank all of our viewers and all of our colleagues inside Iran in the health industry, and send them our greetings, and hopefully one day the Iranian people will be free from this virus, and also the virus of the Iranian regime. Thank you and goodbye.